Welcome to Off Code, the show where we ignore the cultural codes and have real and intriguing conversations regarding the Black community and ways we can move forward to human flourishing.
Hello, and welcome to another episode of Off Code. I am Monique Dusan.
And I am Kevin Briggins, and we have a very important topic to talk about today. One that I'm pretty sure is going to get me in trouble because number one, I don't have a uterus. And number two, I'm pretty sure I'm going to say something that somebody's not going to like. But today we're going to talk about the topic of abortion in the Black community and the Roe v. Wade overturned and what that means for the Black community.
Yes, and we're going to jump in now. I think this episode is going to be a little different. One, it's just a conversation between me and Kevin, and I think that our conversation is going to be very interesting. I am going to be right up front. I do not have kids. Kevin, you do have kids, but like you said, you don't have a uterus. So I think some people would say that we are not the people to be talking about this, but I think we're the perfect people to be talking about it because we're Christian. And the scriptures are what adjudicate what is true. So we're going to start out from that position first. I will let you know that we're going to be working our way through an article from Vox. It came out a couple weeks ago. Actually, just about a week ago. And it's called Black Women Will Suffer the Most Without Roe. So what we're actually going to do is just walk through this article and highlight what is BS and what is fact and what do we think about some of these things and how does it align with the scriptures? Yes, I did just say BS because I really couldn't find another word. Sorry about that, Kevin.
No, it's good. And I read several articles like this. Since Roe was overturned, this kind of been the general narrative. So I think it's really good that we can go through this article because this article is very reflective of how a large portion of, at least in the media, is portraying this. So I think it's good.
Okay, so let's just dig in. The first thing I want to call our attention to is the subtitle, Black women seek abortions at the highest rate and will face greater rates of maternal mortality without the right to choose. So as we scroll through this article, we're going to see, what their claims are, and then, talk about some things that are true within the article and things that may be false. But if we look at the picture, this whole conversation of my body, my choice. Kevin, do you have any thoughts about my body, my choice? Because I have quite a few, but I want you to go first.
Oh man,
if we don't get in trouble, you can go first.
Oh yeah, I'm gonna get in trouble. I have several. Number one, to frame abortion simply as my body, my choice is to ignore the true fact that there is another body in this equation. There's another person in this equation. And so to simply try to boil the law or the issue of abortion down to the woman's body, to me is disingenuous to what the conversation really is. Also, my body, my choice. I mean, outside of a few situations, my body, my choice is a lot that goes into that before we talk about becoming pregnant. So there are a lot of choices that they can make prior to becoming pregnant, that abortion shouldn't really have anything to do with, right?
Yes, I agree completely. People don't understand that DNA starts to form when the sperm meets the egg. It's not like, I was pregnant for, 3 days or 6 weeks or some magical number, and then DNA starts to form. No, this becomes the makings, or this becomes a human person at the time of conception. Life is formed at the time of conception. That human person is made. And what we hear a lot of is, well, it's not, it's not this or it's not that. No, DNA starts to form when conception happens. And so to say my body, my choice, cool, but that's not your body.
Yeah.
Go ahead.
I mean, abortion is the ending of someone else's life. Mm-hmm. It is a intentional, destructive act towards a life. It is not the woman's body that procedure is being done to, right?
Yes.
And so that's to me, that's a dishonesty in the whole conversation.
Another thing I would say is, why is it your body and your choice to do what you want to do with your body in regards to abortion, but it's never anybody's my body, my choice in regards to anything else. Does that make sense? So when we had the whole vaccine conversation, there was no my body, my choice. There was no conversation about that. But my body, my choice automatically comes into play only around the conversation of abortion.
Yes, it is not consistent at all. And I've just found that to be kind of the common theme in conversations I've had around this, or people who tend to take this side. It is just a very inconsistent view. It's almost as if it's a convenient view, right? That they can use simply in this argument, but other places they completely ignore that. It's not a principal argument. It's simply an argument for this discussion. Right?
Yes. Yeah. Now let's scroll down and get into it a little bit. I have so many notes. The United States is now a country without a legal right to an abortion. In this reality, Black women will suffer most. And I call BS, because the legal right to an abortion has not been eliminated within the entirety of the United States. Have some states made some laws that make abortion illegal? Yes. Have some states made certain stipulations against abortion? Yes. But have they completely eradicated it? No. Then are there other states like California, where I reside, that say, hey, we're going to be a safe haven. If you work for Amazon and you want to come get an abortion here, come on over. We'll be a safe haven. We'll protect you. And we have extended laws and money to be able to provide these services. So they start out with a lie, which I think is really to garner the emotions of the readers. But abortions haven't been out and out outlawed in the United States.
Yes, there's a lot of misinformation about what the overturning of Roe v. Wade did and what it meant. It simply said there is no federal protection. And even from my understanding from legal scholars who are more on the pro-choice side, believe that Roe v. Wade was a bad law. Mm-hmm. It really wasn't a precedent for it to stand on. And it was just a bad written law. It shouldn't have never been ruled that way. But you were going through the time of judicial activism, where it wasn't necessarily ruling on what is the law. They were ruling on what they wanted the outcome to be, right?
Yes.
And so we see that. And so it finally got overturned, which it should have been overturned a long time ago. But it simply put it back to the states. So this isn't something that is a constitutional right. This isn't something that's laid out in the Constitution. So either you have to amend the Constitution to include it, or you have to pass something like the Civil Rights Act to include it. Mm-hmm. You can't simply make it up, and which is what they did.
Yes.
And so that's what the court ruled rightly on the law, that this should never have been codified at the federal level. It's not something protected by the Constitution. States are free to make whichever laws they see fit around this. And so that's really where we are. And it's going to be a mixed bag from state to state.
Yes. And, I think that, or not even I think, what I see a lot of is this claim from pro-choice people, like especially in my feed, that say, the government has no right to be in, my choices. The government has no right to tell me what to do with my body, or what I can or cannot do, and things like that. And I'm like, I completely agree. We should have never been in that conversation from the beginning. And so to take ourselves out of that conversation is the right move. And you can put that decision back on at the state level. But then there's this argument too of like, well, the government shouldn't have been in this conversation, but they need to give me the right.
Yeah.
Like, you can't have it both ways. Either the government should have never been in the conversation, or you think that the government should be in the conversation and give you the right. But you can't have it both ways. The government shouldn't have been in it, and they can't be in it, but give me my right.
Yeah, I would say that they would probably be saying they believe that the government should protect their right to choose, right? And so by the government removing Roe v. Wade, they've lost that protection, even though in a lot of cases they haven't lost that right. And even in states that have put restrictions, all the states aren't even complete bans, right? And so, and we'll get into the article a little bit where it talks about how in these states that have put restrictions or bans, the Black population of that state and the percentage of abortions in that state that are Black and all those factors that go into that. We're going to get into that. But yeah, I
way to keep me on track. Keep me on track because I'm just ready to go in. Okay, so going back to the article, thank you. Black women are more likely to live in areas where it's harder to access contraception. They get abortion at the highest rates compared to women of other races due to high rates of unintended pregnancy. The factors that lead some Black women to seek abortions are present from the day they are born, passed down from mothers who face similar plights. Those born into poverty are less likely to have access to health care, let alone reproductive or maternal health care. When some Black women are able to seek care, they face medical racism. For centuries, Black women have fought for autonomy over their bodies against government-sanctioned abuse and abuse from intimate partners. The end of a constitutional right to legal abortion makes this fight harder. What say you?
Do they really want me to say what say me?
Yeah, what say you? What say it all?
I would say they just made up a fake argument. I mean, this has nothing to do with racism or anything. It's almost if they say it, they believe they say it, they put it out there, it makes it true. Right. The issues, and we can get into this, but the reason Blacks are overrepresented in seeking abortions because we also have the very lowest rates of marriage. Right. And so everybody out there single, hooking up, doing this unintended pregnancies, right? 70% are unmarried, and we're going to act like that doesn't affect behavior, you know? And so this is what I believe is going to happen because we've seen people on social media even say it. Women say, oh, well, if Roe v. Wade is gone, I'm not hooking up anymore. It's almost like a slap with men. Like, we're not sleeping with you guys anymore if Roe v. Wade is gone. It's like, that's exactly what you should do. Yes. You should be more selective and careful with who and when you choose to sleep with. That is your body and that is your choice. And now you don't have this safety net to kill the child because you wanted to go out and hook up, right? Yes. And so it's like they think they're making an argument. It's like, that's what you should have been doing the whole time. Yes. Right? And so a lot of these numbers they're talking about are going to be lower because women are going to be more particular about who and when they choose to sleep with, right? Yes. Yes. And so, I mean,
yeah. The first thing that struck me was Black women are more likely to live in areas where it's harder to access contraception. I call BS again. Yeah, right. I mean, if they are talking about poorer Black women, this is an area where Planned Parenthood thrives. They thrive in areas that would be considered like a medical desert. They intentionally set up clinics in like rural areas or places that they would consider rural because they don't have access to what they would consider adequate medical care. But it's like 55, 56% of the Planned Parenthood locations are in these areas. So to say that a woman, a Black woman, would not be able to go and get this contraception, I call BS on that. I'm like, no, that's actually not true. And then to say that Black women seek abortions because of things that are passed down from their mothers who face similar plight, what's being passed down is the poor decision making. Mm-hmm. What's being passed down is this attitude that you don't need to get married or that you can just, sleep around and perhaps have an abortion.
Yeah.
I think that we're lacking something in this. Go ahead.
How how is it that abortion has been readily available to these people, but some kind of way contraceptives aren't?
Exactly.
The argument makes no sense.
Hmm.
So they live in deserts to where they can't get an abortion is really going to affect them. But how are they having the abortions if there's no even way to even there to get contraceptives?
Because yes, the truest thing this article will tell you is that Black women have the most abortions throughout the country. In 2018, and we're gonna get there. I don't want to jump ahead. Let's stay here. Let's keep going. State level abortion restrictions have already taken effect in at least 8 states, and in total, 22 states have laws that impose very strict restrictions on abortion. Those states are home to 39% of the total U.S. population, but 45% of Black women and girls under age 55. The consequences will be dire. The end of legal abortion will trap Black women in cycles of poverty. The consequences will also be deadly. Black women have the highest rates of maternal mortality and pregnancy complications, and those risks will only increase if more Black women have to carry unwanted pregnancies to term. Here are the numbers that show how alarming the situation is. Black women make up the largest percentage of all abortions performed and have the highest abortion rate, according to 2019 data from the Centers of Disease Control, the CDC, and Prevention. The most recent year for which the CDC reported this information. Let's see here. Abortions per 1,000 women in the U.S. in 2019, 23.8%. per 1,000. Other races were 13% when you, add them all together. Hispanics were 11.7% and whites were 6.6%. Out of 629,898 abortions reported to the CDC for 2019, Black women accounted for 38.4% of them. By comparison, white women made up 33.4% of those abortions. So when we break that down into real numbers, that's almost 240,000 Black abortions.
Mm-hmm.
Abortion rates were 3.6 times higher among Black women when compared to white women. The disparity can be explained by inequities in rates of unintended pregnancy, as well as other factors: unequal access to quality family planning services, economic disadvantage, and distrust of the medical system. What say you? Sound off.
Oh, man. Once again, they always try to make it about, let me go back. Since Roe v. Wade has been overturned, I've heard so much about the potential medical reasons for an abortion, right? That's been the issue now. But this article hits at what for years was always been explained as the real reason. Not just my body, my choice, but it's always been an issue of economics, right? It's always the poverty issue, right? She can't afford to have another kid. She's going to be trapped in poverty. She can't go fulfill her dreams if she has a kid. All these, it's always an economic reason, right? And this article finally gets to the whole medical reasons for an abortion. Those are not the primary driving cause or reason.
Yes.
It is convenience and it is economic, right? But as I said earlier, what they're not anticipating is women making different choices, because this is what it's going to force. It's not that women are going to continue to act and participate the same way when they know an abortion isn't available to them. They're going to be more willing to do contraceptives. They're going to be more willing to say no to whoever is trying to get with them, knowing that person isn't in a relationship with them or doesn't have a job or whatever that might be, right? So this issue of poverty is an issue of singleness. It is an issue of baby mamas. This isn't married couple get pregnant unintendedly and needs to have an abortion. No, that's not what's going on here. We're talking about the high rate of unmarried women having babies. That is what this is. This has nothing to do with generational pass down. This has nothing to do with systemic racism or systemic issues. This is about culture and choices, right? And if women start, let's say, holding out from men who aren't willing to marry them, you will see change.
Yes.
Right? You're going to see these numbers change,
yes.
which we should hope. Because this is the thing, I don't know if we're going to get to it, but this is the thing that the whole people that's supposed to be pro-choice and supposed to be Black Lives Matter and we're all of this and all. The Black community is half of what it should be. We've murdered 20 million Black babies since Roe v. Wade. Right? So right now there's a little bit over 40 million Black people in this country. It's supposed to be 80. We're missing half our population.
Yes.
And they're saying that, and they want to act like they're pro-Black and all of these things. It's like, no, you're not. You're pro an ideology and you're pro a political party.
Yes.
That is all it is.
It's like, okay, so let's say that we bought into the idea that they can't, Black women shouldn't be out here having, which was Margaret Sanger's argument, who was a racist eugenist.
We can get into that too.
We can. But let's just say, for the sake of flattering the argument, that, okay, Black women should not be having babies and when they're in poverty. What is being done by the pro-choice side to help bring people out of poverty? There's not nothing being done.
Well, they would say government welfare programs, social programs, but we see those programs do not bring people out of poverty.
They don't bring people out of poverty. You're stuck.
Yes.
You're stuck, and you're stuck with the same morality. It's not that, I had this abortion and now I'm working really hard because I got connected with someone who's going to actually help me change my mindset and my worldview. No, it's that you had an abortion. Now you have all of the emotional baggage that statistically comes when women have an abortion and you still poor.
Yeah. Like I say, a poor woman having a baby is still poor. Like she was poor before. The baby isn't what's making her poor.
Yes.
And so the arguments that they put up just don't hold up to any kind of logical thinking or scrutiny.
The last thing I'm going to say before we continue reading is I want to highlight the passage that says unequal access to quality family planning services. Isn't that supposed to be Planned Parenthood?
That's why they're in all the Black communities.
They're in the Black communities. More than 50% are located in these poorer, more rural areas where people don't have access to adequate medical care and all that. But in Planned Parenthood says that it works in contraception and family planning, because contraception and family planning are synonymous with one another. So is family planning...
You want the truth? You want the truth?
Help me out.
It's only one explanation, because this is what they say. They talk about all these other things Planned Parenthood does, right? You're talking about family planning and contraceptives, and Planned Parenthood isn't just about abortions, but the minute abortion is made legal or struck down, the Planned Parenthood clinic closes.
Yes.
Why is that? If y'all do all these other things, why is it that the minute you can't do abortions, you close?
Yes.
That is, the answer is clear, because they're simply there to do abortions.
Yep.
They're not there to do family planning and contraceptives. And I'm not saying some of that doesn't take place, but their main niche is abortions.
They bread and butter. Yes.
Yes, it's their bread and butter, right?
Yep.
And so, it's not about access to any of these things, because I'll say this: if it's about rural communities, I give you that. You live out in the middle of nowhere, you might not have access to stuff, but that's not a Black or white. That's anybody who lives out in the boonies, right? Hmm? If you live in the hood, if you live in the inner city, I guarantee you there's a clinic. I guarantee you there are resources there in the city for contraceptives, family planning, all of these things. So I really would like to know what the argument is. If you live in the city, why you can't get down to the clinic to get contraceptives. It's just no excuse for it.
If you can figure out a way to get your weave, your eyelashes done, your nails, your toes with the acrylic, but you can't find a way to either get to a place of employment or to get contraception, I feel like something's wrong. I feel like our priorities are just all screwed up.
Let's be honest. Black people are the only helpless people in the country. Every issue is about what Black people can't do. We can't get an ID to vote. We can't find condoms and birth control. We just so helpless. So helpless. Somebody please help us. We're at risk. It's just always the Black people. Always. Nobody else.
Do we not get tired of now? If we want to get real, do Black people not get tired of white people pandering to us? Do we not get tired of this?
I know some that are. I know some that's starting to see it. Like, wait a minute. I'm not slow.
Always have, because a lot of the conversation, which this is taking us way off on another tangent, but a lot of the conversation is this racist white Black conversation that we're always in here in America. Mm-hmm. We're always in this white Black conversation of, oh, it's the white man's fault. Oh, it's this. Oh, it's that. It's whiteness. It's white on Black racism. But then why not empower yourself and show yourself like, well, I can actually do this on my own instead of. Go ahead.
This is what people need to realize where this comes from. This is the educated class, white and Black, the liberal educated class that has been educated within a certain philosophy and worldview, who simply believes that people are born neutral and good, and it's simply the systems that causes these problems. So in other words, a person wouldn't steal if the system wasn't set up for them to be poor, so they had to steal. So there's always a systemic reason for the behavior. And so they believe that if they simply change all the systems, then it would fix all the problems because people are just naturally going to thrive and be good and flourish. But we know that's not the truth. We know that culture matters. We know that a person's value system matters, right? And so it's one of those things of, if you simply are educated to believe that everything is always the system, you're going to always be fighting for the system to change because that's what your belief is in. But the whole time, you're completely ignoring the reality and the truth of what's really happening on the ground and holding people. I'm going to say this word. It's a very popular word right now in a lot of areas. Holding people accountable. Mm-hmm. People need to be held accountable.
Yes.
For their decisions and their actions.
Yes.
Right? This hasn't got nothing to do with the system. Has nothing to do with systemic nothing. Mm-hmm. This all has to do with, who are you choosing to sleep with? Are you choosing to do it without contraceptives at all? Right? And you probably need to make better choices, whether that's who you're sleeping with or, like I say, when you're sleeping with. Like I say, the whole unmarried thing is just a big thing. We won't solve a lot of these issues until that changes. But as long as people are out here just sleeping around and hooking up, and this guy, that guy, this girl, that girl, you're going to end up with these types of numbers. But that ain't got nothing to do with racism or systemic anything. That's culture. That's value. Mm-hmm.
Yes.
Right. And so, and so. No, that's where that comes from. That's where that thought process comes from, of they always have to kind of baby us because they believe that all of our bad decisions and all of the bad statistics that involve us are simply based on our environment and the oppression system that's around us making us do it. So we have no agency. We're not in control of ourselves. We're simply the product of the system. And so, so they believe it's always the system.
Oh, goodness gracious. Okay, let's keep reading. Black people are less likely to receive comprehensive sex education, a key factor in preventing unwanted pregnancies. Evaluations of sex education programs have found that they can help young people delay the onset of sexual activity, reduce the number of partners and increased contraceptive use. One study found that teens who received comprehensive sex education were 50% less likely to report a pregnancy than those who received abstinence-only education. Now, I'm going to stop there because we're going to talk about that.
Mm-hmm.
Now, if you are not familiar with the Center for Biblical Unity's Family Meeting podcast that we do, go back and check out the Family Meeting podcast that we did on July 8th. We kind of got deep into comprehensive today's the 8th. Yeah, so July 7th. We got deep into comprehensive sex ed and what it teaches and what the markers are for each grade level. Here's my issue, and I'm going to let you chime in and just go ahead and bring us all the way home. But this comprehensive sex education stuff is just another way to indoctrinate kids into actually how do you have safe sex, or how do you have anal sex? How do you have relationships that are same-sex attracted or transgendered or whatever, so that you don't get pregnant? It's everything. It's the whole kit and caboodle. It's not
it's not just the birds and the bees.
Yes.
That's not what they're teaching. No, it's a comprehensive, what was the term they use? Like they had like pleasure in it, or
pleasure-based sex ed.
Yes.
It's comprehensive, queer inclusive, pleasure-based sex ed.
Yes. And I don't know where they got their numbers from. I've heard other studies where people say there's been no evidence that sex ed stops pregnancy. I got sexual ed in high school, and it didn't affect anything. This idea that people don't know where babies come from, or how to prevent babies from coming, like, we know,
right?
It's just whether you choose to. It's a decision.
Yes, but the thing with the comprehensive sex ed that I want to caution parents against, and I would say if you're a parent watching this, or aunt or uncle, grandparent, whoever, if you are involved in the life of a child, look into comprehensive sex ed, because what it teaches is that your child, or the child that you're involved with, is going to be having sex. That is that's the way that they approach this conversation. And since you are going to be having sex outside of the confines of marriage, you should know all of these things. You should know about masturbation. You should know about anal sex. You should know about oral sex. You should know about a whole range of things that are not appropriate for a child, a sixth grader, to know during this time of their life. And I would say, according to Mo, if Mo ruled the world, I would not be having my child's teacher teach them about anal and oral sex. I'm
glad you said sixth grade, because I guarantee you people hearing this are automatically thinking, oh, this is high school. These are seniors. Like, no, this is K starting at K and through middle school and beyond. Like, all of these things they're teaching, because it's comprehensive, right?
Yes.
And so I mean, like, not to get off topic, but people need to understand that when they talk about comprehensive sex ed, it's more than just the birds and the bees.
It's more than the birds and the bees. And why aren't if let's just humor them and say that this their numbers are 50% less likely to report pregnancy. Okay, I can run with that. Why is the question? Why are they less likely to get pregnant? I would say it's because they're pushing a transgendered or homosexual agenda, and that's not going to get pregnant no way.
That's one way to think about. I'm pretty sure that that is probably one way, and they're also involved in a lot of other activities that you probably can't get pregnant from. Yes,
I do have that in my notes, but yes, there's a lot of other activities that are not going to necessarily lead to pregnancy that are being taught to young people. But there is a push. We have to understand there is a push for this queer ideology, this transgender, this homosexual, that is outside of, and we come from a historically Christian perspective. So if you aren't a historic Christian, if you aren't a Christian at all, please understand that these are the positions of the historic Christian position. This is the position of Scripture. They're not pushing things that are in line with biblical support, with Scripture. They're not pushing have sex after marriage. They're not pushing that sex is between a man and a woman. And so this comprehensive sex ed is way more than what many people are banking on. You ready to keep going?
I'll add this too, because you talk about the historic Christian view. I think it's very important that we say the historic Christian view is the predominant Black view.
Yes.
Right? That is, I don't want that to get lost, to where the Black community is deep rooted in historic biblical Christianity, right? It has affected our culture. It has affected so much because you talk to a Black person, more likely they're going to tell you they grew up in the Black church.
Yep.
To some, and so don't think that what they found out every time they do polls, that Black people are super conservative, because we are. Because we were raised in the church, but we are taught to identify with different ideologies and political parties that don't line up with our worldview and our beliefs. And so when people start saying these particular positions, they come across as not the traditional Black view, when in reality they are. It's almost like the Blackest thing you can be is conservative, because we're conservative people. Yeah. Right. But in the political debates, we switch to the other side because that's the side we're told we have to vote for our survival. And so we end up condoning other parts of their platform, because to us, Team Democrat means Team Black, even though that's against our own personal convictions. Right. And so I just want to put that out there, that the historic Christian position is the predominant Black position, because Blacks are Christian, typically conservative.
Yep. So. All right. Thank you. Let's keep going. According to one report, Black youth, low-income youth, and youth from single-parent households were less likely to get formal sex ed, and Black youth were more likely to receive abstinence-only education, which is ineffective and stigmatizing. This is despite the fact that another survey found that most Black people favor comprehensive sex ed for young adults. Were you going to say something after that?
No, I guarantee you, if they define what comprehensive sex ed was, Black people wouldn't be for it. Exactly.
Access to contraception like birth control and condoms also reduce the rate at which women have unplanned pregnancies and seek abortions. Yet Black women are more likely to live in contraception deserts, areas where barriers to purchasing contraceptives are higher. As a result, Black women ages 15 to 49 are less likely than other racial groups to use birth control regularly. They are also less likely to use prescription contraception, such as birth control pills and long-acting reversible contraceptives, like an IUD or a birth control arm implant. The most effective forms of birth control are abstinence and permanent sterilization. The most effective forms of birth control after abstinence and permanent sterilization. Those between 18 and 24 tend to prefer condoms, which are a less effective way to prevent pregnancy. The racial gap in contraception access and use is rooted in social and structural racism and discrimination. For one, it's difficult to access prescription birth control without health insurance. Black women and girls are uninsured at roughly twice the rate of white women and girls, according to data from 2020.
Because we're not married. If you're married, more than likely you're going to have insurance. This is an issue of singleness. That's what this is. Poverty is an issue of singleness. All of these issues are an issue of singleness. This has nothing to do with structural racism.
I can vibe with you on the like being single can, play into that. But as a single person, I don't know that it's all that. Like, I think
guarantee you looked at the. Go ahead. Go ahead.
I think it's an issue of morality. I think it's an issue of choice. I don't think it's an issue of singleness, because I can be poor and choose not to have sex. True. I can be poor and single and make the choices that are needed to never need an abortion. So the fact that you're like this idea that singleness is why I don't have insurance could be true. That could be one indicator of it, but it could be that I am underemployed and am not seeking out what it takes to actually go and get a better job. I could be single and haven't been responsible enough to go and look and see if I qualify for Medicaid or something like that. I'm not saying that I am fully all on board with all these government subsidies and things like that, but you also have to think like there are things available for you. If you are so pro-Democrat and the Democrat Party has made available to you different forms of welfare or social assistance, well, go and take advantage of it. It's there. It's available to you. But instead, what we're saying is that there's nothing available. I've been in social service for a little too long. I know what's available. So as a single person, these things are available. You can go and sign up so that you can get maternity care, that you can get prenatal care. Yes. And you can go put it on Kaiser, put it on Cigna, put it on United, whatever. But there are options so that you can have prenatal health care for you and your baby. It doesn't always end just because you're single in abortion. Singleness is not the cause of abortion. Singleness may be the cause of poverty for some people. I'm single and I'm not in poverty, and I praise God for that. But I think that to limit it down to singleness, to be like, this is all because they don't have insurance because they're single. I feel like that makes it a little too easy for people. It's like, no, you should need to go do the hard work and figure out what is available to you.
No, I agree with you. I was simply saying the reason for the discrepancy in numbers, right? They keep saying we're more likely to not be insured. We're more likely to do this and that. And a lot of that more likely is tied to the fact that more Black women are single, right? Because if they were married, I guarantee you they would have higher rates of insurance, right?
I think so. I mean, I think that's a possibility. But I think, I guess I question why you don't have insurance when you drive a Benz, when you're making your car note. You might live in a studio apartment, but you driving this, this Cadillac. You might, be in your Nissan Altima in your studio apartment, but your lashes, nails, and weave is done.
Yes, we choose. Insurance? True. Yeah, you're right. There is a sense of there are choices made, right? And we prioritize, and our money goes towards what we prioritize. I mean, that is a true statement. There are a lot of nice outfits, nice shoes, nice weaves, nice hair in the inner city, right?
That's all. I'm like, if you can go and spend, I know. Okay, y'all, I was looking at getting a weave, and I chose not to because it was going to cost me $1,500.
The devil is a lie.
The devil is a lie, but it was going to be good. But I'm single. And if I choose to spend my money that way, that's what I choose. I'm not worried about taking no money out of my kid's mouth. I'm not worried about, not paying my rent. My car is paid off. Like, I'm not worried about that. But you have to ask, like, now what you're saying is that basically your hair would be more important than this life. Or your hair and your external, circumstances and to-dos are more important than getting insurance.
I would say this, at least the article is painting it to where Black people have no choices and no hope. And it's all going to crumble down because Roe v. Wade is overturned.
Yes,
right?
I'm
That's
glad
the
that
picture
you
they're
made
painting.
that distinction. Yes.
Yes.
Yes. Yes. Okay, let's keep going. My goodness gracious. Black women in the South, where a number of abortion bans will take effect, have the lowest rates of health insurance coverage among all Black women. Some Southern states, like Mississippi, have refused to expand Medicaid coverage, which has prevented Black women in those states from having better health outcomes. Black women in Medicaid expansion states have experienced fewer maternal deaths than those in non-expansion states. Overall, Black women have less access to quality health care and less trust in medical professions who might recommend birth control. The medical profession has a history of pressuring Black women and other women of color to limit their family sizes and consider tubal sterilization. After all, the American father of modern gynecology experimented on enslaved Black women in the 19th century without anesthesia. More than 1/3 of Black women in a 2005 survey believe that medical and public health institutions use poor and minority people as guinea pigs to try out new birth control methods. Research in a 2019 study found that Black women tend to live near pharmacies that impede the purchase of contraception. The obstacles are many: limited hours, fewer female pharmacists, fewer patient brochures on contraception, condoms that are difficult to access, and fewer self-checkout options. If
They went to self-checkout options.
y'all want to talk about some ish? There's some stuff right here, and we can go back. But I'm like, okay, so these are the obstacles: limited hours. Limited, or what are they only open 2 hours a day? If a high school student can figure out a way to get a condom, you as a full-grown human person can't get a condom.
That whole section.
Fewer female pharmacists.
That whole section about the whole experiment and stuff, they always try to root something that somebody they ain't thinking nothing about. Nobody today who is about to have sex is not thinking about some probably 100 years ago, 200 years ago, and what happened to Black women in the experiment. Nobody is thinking about that. Also, they clearly left out. They said Black women and women of color often pressured to limiting their family size. Who does that? That's Planned Parenthood.
Mm-hmm.
That's Margaret Sanger, who didn't want the Black population to have as many babies. Right? That was the whole purpose of Planned Parenthood, was to limit the reproduction of people that she considered the undesirables, which were the poor and minorities. Yep. Mm-hmm. And so she put all her clinics in minority communities. And it has been successful, as the Black community is half of what it should be. Right? She did her job.
Here's my question. So, if 1/3 of Black women believe that medical and public health institutions use poor and minority people as guinea pigs to try out new birth control methods, why go to Planned Parenthood for your abortion when you're going to the clinic that was started by the racist eugenists?
That is a good question.
Why are we doing that? I don't understand.
Because this is the thing, and even though we're talking about that, and even the way they put it in this article, you know why we talk about it and why the article is talking about it? Because we're educated to a certain degree. The person in the hood that is living their everyday life, that is going to get medical care or is going to get abortion, they are completely unaware of that history. That's why it's irrelevant to even put it in the article, because that's not what's determining people's actions.
Yep.
You know, it is people who are highly educated that write this stuff live in a bubble. They live in a bubble, and they do not realize it, that the person on the street couldn't care less about this type of stuff. Even when you get into the conversations about systemic racism, all that kind of stuff, you go down to the hood, you talk to somebody, that's not what they're worried about or talking about, right? That is a very high, affluent, educated, privileged point of view to have, right? And so with this article, it's missing, and the reason that they get the solution wrong is because they've misdiagnosed the entire problem.
Oh,
right?
come on.
It is. They simply want to put it on the system, on history, on racism, on systemic issues, on not enough self-checkout counters.
No.
Like that is not the root cause of this issue within the community. Yep. It's something deeper than that. Mm-hmm. And it's not something that happens to the community. It's something internal to the community. Right?
Yes.
And it has to be. Because if it's not internal to the community, then the community has no power to change its own situation. Right? Mm-hmm. And once you believe that, you created this hopelessness. Right? But once people believe that they have the power to change their own situation, they have agency, you start to see people be empowered to make different decisions and to move differently. But as long as we keep telling people that their situation is because of the systemic issues around them and the racism and this and that, you've created a sense where you keep them in that place, right?
Yes.
And
and so because they're tethered to you then. They're then tethered to the party that helps them all the time. Because there's now a narrative that you can't do it yourself. There's a narrative of hopelessness, and we're going to be the party of hope.
Yes. Yeah. Yeah, but preaching accountability and self-improvement and self-change doesn't drive votes. Yeah. Right? If you have the power to do it yourself, why do I need you? Right? Mm-hmm. If I can simply do it myself, if I can make better decisions, I can make different decisions, if I can choose, not to sleep with this guy, or I can choose to take advantage of all the other resources available to me. Because let's be honest, we're both from the hood. You've been in social work a long time. We all know the number of programs and resources that are available to everybody there.
Oh yeah.
Right.
Oh yes. Yes. We can go down the whole list. You can get prenatal care. You can get, you can sign up to get, especially if there's like a PRC in the hood, they'll do your baby shower for you and get you some like furniture. There's like you can go to, is it Catholic Charities? But one of them will assist with like move-in costs, furniture stuff. You can get rental assistance. You can get your light bill paid. You can get your gas bill paid. You can get a cell phone. You used to be able to. I'm not sure if that Obama phone is still in effect after Trump, but you used to be able to get a cell phone. You can, I don't know.
There's no lack of resources.
More? There is no lack of resources, short of living your life for you. I don't know what else our government and our tax dollars can do. Like I said, you can get food stamps, you can get medical insurance, you can get help with the down payment on a house. You can literally be on HUD on Section 8 and qualify for a housing program.
Yeah. I mean, but
you can get help with your ID
because none of those things drive change. They simply create a dependent class. That's the issue, right? Yes. And so because the numbers don't improve, they keep thinking, oh, they need to do more. They need to do more. We need to do more. And and that just goes right to this. The framework of this abortion article is simply saying that things are bad or things are this because of a lack of resources.
Mm-hmm. Now, I do want to highlight what they're saying about, the Black woman's history, like the gynecology, the gynecological issue with the gynecologists during slavery and how experiments were performed on Black women. That is true. You can look at the Tuskegee experiment and different experiments that were performed on Black bodies. That is true. Now, Black people are not the only group of people in America that have had medical experiments performed on them, but to list this, as a piece of data in our history. I don't want to just gloss over that and act like that never happened. It did happen.
No.
I'm leery. This is why Monique herself is leery about government assistance, because sometimes they assistance be experiments, but that's a whole nother conversation for a different day. Let's keep going.
Yeah.
Were you gonna say something else?
No, I'm saying no. The history is the history. I only question how much of today's individual choices and decisions are driven by that history.
Yeah.
Right.
So. Yeah, I feel you on that. Okay. And when they obtain contraception, it's more likely to fail. Another report found that Black women and women with low socioeconomic status also have higher rates of contraceptive failure than white and high socioeconomic status women, even when using more effective forms of contraception.
What does that have to do with anything?
I'm not even... So the way I read it is that the birth control for poor people doesn't work.
Does the birth control know your economic status? Like,
even when it's a more effective form, it makes me wonder, are you doing what you're supposed, are people doing what they're supposed to be doing with the contraception the right way? But we just gonna keep going.
Yeah, because
Okay, we are about halfway through this article and there's a lot more to cover. So what we're actually going to do is put a pin here, and on our next episode of Off Code, we are going to finish out this article so that we can get deep into it and we don't have to rush you or us for time. So thank you very much for watching episode 1 of Black Abortion. We will be back in a few weeks to hit on the rest of the article. Thanks so much.